Yes. Jubilee Health Insurance. You know, I'm going to start on a light note.
Yes.
There was or there is a political party in this country that is called Jubilee, and there was this connotation that the insurance firm might be associated in any way whatsoever. Kindly clear the air.
Absolutely no
Yeah.
association.
Yeah.
Jubilee Insurance was established 1937. Jubilee Party, I think, is latter day
Yeah.
2000 party.
Yeah.
So Jubilee Insurance was established 1937 in Mombasa and moved to Nairobi, I think, after around 10 years.
Okay.
So as an insurance company, I think we were robbed of the name Jubilee.
Yeah.
But we are happy that Jubilee Party now is no longer existing, so we can continue to retain our name.
All right, and on that quick clearance, what is insurance? Because many people seem to convolute the meaning of insurance. What is insurance?
Essentially, insurance is protection against financial losses. Protection in the sense that you anticipate that we live in a world that is full of risks.
Yeah.
So specifically, I'll speak to health insurance because that's what I do for a living.
Yeah.
In health insurance, you anticipate that people fall sick, and or even if they are not sick, you pay premium to an insurance company.
Yeah.
So that in the event that you are unwell or that you need certain checkups, then the insurance company will pay for those checkups within the agreed terms of the policy that you have with the insurance company.
I don't know if my viewer is very keen, but I am very keen because I'm asking the questions. There are two keywords that you've used, and I want you for you to expand a little bit more. You have used the word policy. We know policy to be government related, and there is a word premium that you've used. What are these two words, and what do they mean in insurance?
So I'll talk about first of all starting with premium.
Yeah.
Premium is the price of your insurance. The price in the sense that an insurance company will give you a cover of a specified amount. Typically, for example, an amount of 500,000 shillings for your inpatient coverage.
Yeah.
And the insurance company will require you to pay money that goes into a pool, and that's what we call premium. Typically, that amount is a fraction of the cover amount, so it could be 50,000, 60,000, 20,000, depending on the cover amount that you require. That's what we call premium.
Yeah.
Policy, and those are semantics in our industry, is the contract that we have between the individual buying insurance or the corporate that is buying insurance and the insurance company. So it's exemplified, of course, in something called a policy document, which is essentially the evidence of the contract that exists between the insurance company and the individual or the corporate. Yes.
Interesting. What determines policy is understood, but premium, just to probe a little bit more, who decides these premiums, and what advises these premiums? Because you've said 500,000, I might be with my 50,000, and 500,000 has already put it out my reach.
Yeah. So an insurance company employs the services of people called actuaries. Actuaries are professionals who are well trained in the mathematics of insurance. They arrive at rates that an individual would pay or a corporate would pay for the insurance. Now the actuaries set out the premiums that are payable by an individual. They calculate. There's a whole science that goes behind premium calculation.
Yeah.
It includes, for example, the age of individuals. Typically, you'll find that younger people would pay less premium compared to older people because of the propensity for sickness older people tend to be more sick than younger people. Other factors that would influence your premium would be your scope of cover. For example, if you want higher benefits, higher benefits will probably cost you more than lower benefits. In health insurance, where you choose to go for treatment, you have service providers can also influence your premium. So typically, for example, there will be a whole host of lower level hospitals. There will be high-end hospitals. So as you know, if you want to eat at Serena, you pay more. If you want to eat at Koseo, you pay less. That's how it is.
Yeah, interesting. But before we even go into some of the now more nitty-gritties into health insurance, why should anyone have health insurance? Why should anybody look for a cover for health insurance? Because we come from a community, from the African traditional setting, where we trust our mitishamba. Yeah. Now you're telling me to anticipate that I'm going to get sick, and I pray every day not to get sick.
Yeah, thanks Alan. The point is this: the mitishamba, of course, exists, and much respect to mitishamba.
Yeah.
And I have traditionally we were treated by mitishamba. I think that the problem that would exist in that space is that the people who are knowledgeable in mitishamba could also be fewer. So it may not be accessible to all of us.
That could also be an opportunity for insurance.
Thank you. Let's talk about why people need to buy health insurance.
Yeah.
Because you don't know when you fall sick and how sick you can be.
Yeah.
Now, sickness can be catastrophic in the sense financial catastrophe. Not necessarily catastrophic that you'll die.
Yeah.
But financial catastrophe.
Yeah.
I have given an example of somebody who requires a tetanus vaccine because they have a small injury. And tetanus as a disease in itself can be very catastrophic in terms of costs.
Yeah.
Coming back, assuming even the things that we take for granted, normal delivery, when a mother needs to get a baby, she needs to go to hospital and get her baby. There can be complications in that space, and which can be very costly. So it's important that we prepare ourselves for such costs, so that we are not whitewashed, and so that we lose our livelihoods in terms of the money that we ever had. Out of pocket payment is not sustainable as a long-term solution for our health costs, or mitigating our health costs. You might need a lot of money in the pocket, and it's not possible to all the time to have money in your pocket to pay for your medical expenses.
Yeah.
And that's why health insurance comes in. Yes.
Interesting. Now I want us to take a quick break, and when we come back from the break, there is a viewer here who is saying, Alan, you haven't really told us, or the guest hasn't really broken down in the simplest terms how health insurance works, from the point of me now seated in my house, now deciding, okay, I have my small resources, I think I need to insure myself to get an insurance policy or an insurance health cover. You're going to take us through that point, from the point of me deciding to the point of coming to Jubilee Insurance, and what happens after that. And in case I get sick, how do I claim my benefits? Because we've heard a bit about insurance companies that do not remit claims. Yeah. Thank you very much for watching. We're going to be back after the break. Do keep it Science TV.
Breakfast show brought to you by KCB. KCB Mobile Loan ni mkopo flexible kabisa na kwa viwango nafuu. Pata mkopo hadi milioni 1 kwa kiwango cha 1.2%, ulipe ndani ya siku 1, siku 7, siku 14, siku 30 au mkopo wa muda mrefu hadi mwaka 1 kwa viwango nafuu. Kupata KCB Mobile Loan bonyeza *522# au tumia KCB app leo. KCB, for people, for better. Sheria na masharti kutumika. Inadhibitiwa na Benki Kuu ya Kenya.
Max, it's too boring out here. There is nothing to do. Don't be silly, Lily. Look around. We have a whole yard to explore. But it's all just dirt and grass. I wish it was more exciting.
Whoa! Careful there, little one. Don't you know rusty cans don't belong in the grass?
A talking sunflower. Who are you?
My name is Sunny, and I'm here to tell you all about keeping our environment clean and healthy.
Cool. Can you tell us why that can shouldn't be here?
Absolutely. Rusty cans and other litter can hurt animals and pollute the ground, just like dirty water can make us sick.
Yuck. I don't want to get sick.
Exactly. We need clean water to drink, bathe, and stay healthy. Dirty water can cause tummy aches and even worse.
So, how do we keep the water clean?
Throwing trash away properly and recycling are great ways to start. Every little bit helps.
You mentioned something about hurting animals. How can litter hurt them?
Animals might mistake litter for food or get tangled in it. Just imagine a little bird with a plastic bag stuck on its leg.
I don't want to hurt any animals.
That's a great attitude. And speaking of things that can hurt us, there's also something else called lead poisoning.
What's that? Sounds scary.
Lead is a type of metal that can be found in old paint or even some toys. If it gets into our bodies, it can make us very sick.
So, how do we avoid it?
We play in areas free from peeling paint and choose safe and clean toys. Adults can also help us by checking our toys before we play with them.
Okay. Clean water, no litter, no lead. What else can we do for our environment?
We can breathe clean air by planting trees like me. Trees help us breathe better by taking out bad stuff from the air.
Trees are awesome. And what about food? We need food, right?
Of course. But we should eat clean and healthy food. Fruits and vegetables are the best. They help us grow big and strong.
I get it. A clean environment keeps us healthy. We need clean water, clean air, safe food, and no litter.
You got it. Remember, even small actions like throwing away trash properly make a big difference. Now, let's all work together to keep our environment clean and healthy.
Let's pick up that can, Max, and maybe plant some seeds later. Great idea, Lily. Together, we can make a difference.
A healthy life begins with a clean environment. Epuka uchafu, afya nyumbani. This message is brought to you by the Kenya Ministry of Health in partnership with USAID.
Breakfast show brought to you by KCB.
KCB Mobile Loan ni mkopo flexible kabisa na kwa viwango nafuu. Pata mkopo hadi milioni 1 kwa kiwango cha 1.2%, ulipe ndani ya siku 1, siku 7, siku 14, siku 30 au mkopo wa muda mrefu hadi mwaka 1 kwa viwango nafuu. Kupata KCB Mobile Loan bonyeza *522# au tumia KCB app leo. KCB, for people, for better. Sheria na masharti kutumika. Inadhibitiwa na Benki Kuu ya Kenya.
That break, glad you're still watching Science Breakfast with me, Alan Habert, and the sign language interpreter is Gideon Minor. And this morning we are speaking to Mr. Kenneth. He is the General Manager of Operations at Jubilee Insurance. And this morning we are talking about insurance, but not just insurance. We are talking about a key component or a key concept in insurance, which is called health insurance. And Mr. Kenneth here has said that you basically insure yourself for unexpected things that might happen, and you never plan to get sick, so that is why you are supposed to get health insurance. And also, as the saying goes, you are only one sickness away from poverty, so you do not want to get yourself in a situation where you have to pay out of pocket, unfortunately, when you fall sick. Before we went for the break, we had asked Mr. Kenneth to explain to us. I am seated back at home. I finally gone over my fears of the misconceptions that I've had about insurance, and finally I'm going to take a health insurance cover. What do I need to do, and how do I start on this journey? And we're going to narrow it down to Jubilee Insurance. Mr. Kenneth, how do I go about this?
Thank you, Alan. Jubilee Insurance, I'll speak about Jubilee Insurance.
Yeah.
And if I need to speak about other insurance companies,
yeah,
maybe that's not my job.
Yeah.
But Jubilee Insurance, so starting with our physical location, because I think customers may need to know where this company is located.
Yeah.
We are located on Wabera Street, next to City Hall. Ahead of us, of course, is the Supreme Court. Wabera Street, we have a customer care center located on Jubilee House, Wabera Street, on the ground floor. We are also available on all social media platforms.
Yeah.
We are also available on phone contact, and I'll provide those phone contacts in a short while that you can reach us. We also have branches across town, Bungoma, Meru, Mombasa, Eldoret, Kisumu, and Nairobi. Within Nairobi, we have branches in Westlands and a number of outlets within town. But that said, there is the best starting point is that we provide a number that you can call us, and we are available to provide all the information. And by the way, our care service, what do you call it?
Customer service.
Customer service.
Yes.
Our customer service representatives are available. Once you call, the number will be picked by any of the customer service representatives, and they'll provide all the relevant information, including guiding you on the various products that we have in health insurance.
Yeah.
Yes.
And talking about insurance, the best product, how can one choose the right plan for them?
So typically, as an individual, before you buy anything, you need to think about, one, your budget, that you've got to be able to afford the product. Today, of course, we have put forward quite a number of affordable products, as low as 6,200 shillings. You'll be able to buy a health insurance product that can take care of you in a year. But that said, it's typically you must start with looking at your budget. Then you look at your circumstances and your needs. There are people who may not be interested in taking care of, for example, outpatient costs. They say these are small costs, I can pay for them. I'm interested in the bigger costs, that I need protection in the event that I'm admitted in hospital. So we have products that would be typically only inpatient. So you also need to look at your circumstances. Do you need dental cover? Do you need optical cover for your eyesight and for your teeth, oral health? So once looking at your circumstances, look at your family. If you have a family, you are a father, you have married, you have a wife, and you have a child, you must keep in mind that if this child falls sick, you should be able to meet the obligation without having to dig deeper into any little money or any little savings that the family has. So your circumstances will typically determine what kind of products that you can buy, or which insurance you need to buy. Yes.
Looking at the 6,200 cover, probably you might not be able to break it down vividly, but just paint a picture for us, because 6,200, somebody might be watching and they're already interested.
Yes.
How would that cover look like? And also share a sort of a sneak peek of you've shared of about a father, mother, and one child. How would that cover also look like, and what would be the cost?
So typically, that is the product I'm talking about is called Cover Bora.
Yeah.
It's one of the most affordable products in this country for an individual to buy. So as an individual, you need to put aside 6,200 as a premium that you need to pay for 1 year.
6,200 for a year?
Yes.
What does it cover? I'm sold.
And that gives you a cover of 250,000 shillings.
Yes.
For your inpatient. It's typically an inpatient cover.
Yeah.
Because hospitalization, once admitted in hospital, that is where as they say, the rubber meets the road. You have to deal with costs that are out of this world.
Yeah.
Typically, on an average Kenyan walking in the streets does not have 200,000 shillings in their pocket to pay for bills.
Yeah.
But an average Kenyan probably has 6,000 shillings
throughout the entire year.
Yes. So once you pay that, an additional member will pay 1,320 shillings to add a child onto that particular cover. And to me, that is it's a low-hanging fruit for people who would be looking for at least the very basics of insurance.
Yeah. Speaking about the very basics of insurance, I know also you are here to reach out to a demographic that probably that might not be reached by insurance services. Have you, as a firm or as a company, have you put in place any covers that would say cover persons with disabilities? Give you case in point. For a person with albinism, or per month, they have to spend upwards of 2,000 roughly. 2,500, 2,600 Kenyan shillings for a bottle of sunscreen. In a month, a person with albinism would use 2-3 bottles of sunscreen out of pocket. From a Jubilee insurance point of view, what could you be able to do? And also, could you extrapolate if you have any products that are specific for persons with disabilities?
Yes, thanks, Alan, for that question. We have put products out there, and our products would cover both people without disabilities and people with disabilities without discrimination.
Yeah.
So what that means that if you bought a product from us, and typically a product that covers you both for outpatient and inpatient, it would cover for your sunscreens, including your routine checkups, because sometimes you don't need to be sick to go and have a checkup, so that a doctor, then you don't need to be sick to go and see a doctor. You need to have a program for what we call wellness. Go see a doctor to check that you're okay, and that is part of well-being anyway. So we have products, yes, that would cover, including people with disabilities, and by the way, not just albinism. We have had within our policies individuals that are mentally challenged. And that is a disability in itself.
But we would call it a psychosocial disability.
Psychosocial disability. Within our policies, we extend coverage for those, especially if they're children. Typically, children would be covered up to 25 years. And we do an extension beyond 25 years for people who have certain disabilities. That tells you that we are cognizant of the fact that people with disabilities have special needs. So beside, of course, covering the sunscreens and other eye checkups that people, for example, with albinism will require, and by the way, so our policies would also cover for your optical, your glasses. So it's across board. There is no discrimination. But should there be a specific requirement, then the company is able to respond to that requirement by customers.
You know, many companies, or some companies, let me not say many, some companies would find it tough to engage persons with disabilities because there is this misconception that it is hard to deal with persons with disabilities. From a Jubilee standpoint, how have you put mechanisms into place, from sign language interpreters to having floors that are designed out well, hallways that are big enough for a wheelchair user to be able to walk into your office. Have you been able to do such things as an organization?
Yeah, thanks, Alan. As an organization, we are cognizant of all this, and not just even as the insurance business.
Yeah.
Both architectural design, the building is designed to keeping in mind that there will be people with disabilities that will come to the building as our customers. Typically, for example, and maybe that informs why our customer service center is on the ground floor. But suppose that somebody with a disability needs to go up. Of course, we have escalators and lifts that would bring the customer up. If there is somebody, for example, who is impaired, is deaf and cannot communicate, then we put in place a sign language interpreter for that customer so that we can effectively communicate. One of the things that we are now doing is that we want to re-engineer our apps so that they can speak to people who require, for example, sign language or people who require to use Braille. So then we put our documents in a format that can speak to that demographic. So, and as a company, of course, Jubilee is well resourced. I mean, of course, you know that we are the #1 insurance company in this market. But we are not
that is a quick brag,
But we are not saying. So, yes, responding to the needs of customers in that space is for us is one of the quick wins that we have. Yes.
Right. Interesting there. As we are coming to the end of the conversation, there are some other questions that I've just streamed in here. And one common question because you said insurance pays your bills. You live insurance, you live health insurance, and you eat health insurance. What are some of the outstanding misunderstandings that you have come across around health insurance that you would want to demystify before we come to the end of the conversation?
Yeah, we are Kenyans.
Yeah.
And as Kenyans, we always have this tendency, there's something called procrastination, which is our disease, including myself. So we will postpone a decision to buy health insurance up to the point when it's a little too late, when we are desperate, when you are sick in hospital. So, and then the misconception, the perception that insurance is too expensive. It is complicated. It is for those rich people, those people who are driving big cars. So that's not true. There are products that speak to every segment of our society, and virtually anybody in this country can afford some form of insurance from a private insurance company. So my biggest concern about our misconceptions is about that it is complicated. I cannot understand. So our job is to explain the product to the customer. Our agents will explain the product to the customer, and the customer has an opportunity to ask as many questions as possible. And by the way, typically as a practice of insurance, once we have sold the product to you or you have bought a product to us, we issue with a policy document which details the scope of cover, explains the things that are in this coverage, and you have also an opportunity to look through, and we give you 1 month to read at your own leisure, read and understand and ask as many questions. And the customer can make a decision if they don't want this policy and cancel it and receive a refund of premium if they don't like the product. That opportunity also exists. So it's not too complicated. Speak to us, we'll provide all the information available on health insurance. And it's in our best interest that a customer has understood. It's not in our interest that a customer has not understood.
And before we wind up completely, 2 more questions. One, I have government provided health care insurance, that is HIF, SHIF, NHIF, still convoluted, but remittances are still made, but now also have to take private insurance. How do the two work?
So typically, of course, and SHIF is also, I also contribute to SHIF, or NHIF for that matter, which is now metamorphosing. They complement each other. That's the answer I would give you. Sometimes your medical bill may be higher than the private insurance that you bought. SHIF should come in and pay the difference. Or if SHIF has paid for your insurance, for your medical bills in hospital, and it's not adequate, the private insurance should come in and pay. So they should complement each other. They do complement each other in a lot of situations. There are situations which, depending on the policies that exist at NHIF or SHIF, which is difficult for me to talk about right now, that make them not able to be obliged to pay your bills. But we stand obligated to pay your bills for as long as you bought the insurance from us. It's also possible for somebody to buy health insurance from 3 insurance companies. And then both of them will participate in your bill, should that bill exceed the first and the second insurance company. Yes.
Okay. One would say then, why don't you just collapse all these funds and give it to a single entity? But anyway, as we're winding up, what would be your advice to somebody who is still contemplating, you've said procrastinating, what would be your advice and your rallying call to somebody who might be procrastinating to get health insurance?
My advice is take the decision now, speak to us, because we live in an uncertain world and you never know when something is going to go wrong. And something may go wrong, could be sickness, could be an accident. Take an insurance policy today so that it can cushion you against unexpected bills or bills that you do not have a budget for. At least you can have a budget for an insurance policy. You know that I'm going to pay 20,000 or 5,000 or 15,000, whichever amount. That you know. You don't know how much a medical bill can cost you. So it is in your best interest and in all of us' best interest that you buy an insurance policy. We have products, like I mentioned earlier on, that speak to almost everybody. So the excuse that I do not have money is not good enough, because when you are faced with a bill and you do not have insurance, then as Kenyans say, utajua hujui.
Utakuja harambee hatutatoa.
Exactly.
You also spoke about last minute. I can take a premium right now. How soon does it cover me?
Typically, there is an insurance product. So there are 2 categories of insurance in this market. Corporate insurance and individual insurance. Corporate insurance, by virtue of bargaining power of the corporate, would have a no waiting period for specific illnesses. Individual policies would give you typically a 30-day waiting period, and that's called a waiting period. And the sense, in principle, and as advised by our regulators, that people should buy insurance for legitimate reasons, not to buy insurance for what we call in our industry anti-selection, that you have chosen because you have an illness which you need a surgery tomorrow, then you go and buy insurance that it pays. The principle of insurance is to select what we call good risks. All of us come together in utmost good faith that we are putting resources together to help us in the event of sickness. But you're not buying insurance specifically because there is a surgery that is planned for tomorrow. So that those regulations are designed all over the world to protect insurance companies from people who would select against that particular insurance company. The word selection here is used loosely, but in the insurance industry has a specific meaning, to mean that you have you actually have a claim. It is not unforeseen. So
it's something that you've
this,
already seen,
yes.
and you're like, okay, it's about to go down.
Yeah,
I need
so,
to do something.
So buy insurance, let that event happen, unforeseen, and the insurance company will pay. So having said that, once the 30-day waiting period expires, then we are good to go. However, I must point out that accidents do not have a waiting period in an insurance policy all over the world. If you bought an insurance product today and on your way home
you found yourself in an accident,
have an accident, the insurance company will pay your bills to the full.
So if I've already appended my signature on the policy,
that is enough.
Do I have to disclose my health situation or my health status?
It's good. It's good not just because the insurance company does not want to cover you. The insurance company wants to cover you, but also you remember that we have various plans, including wellness plans, that we can put in place for you depending on the conditions that you've declared. So we have policy holders that, for example, are diabetic.
Yeah.
So we have diabetes programs that would then help them, that particular client, to go through that program so that they can lead a healthy and productive life. So it doesn't serve you to not disclose the conditions that you have. People are afraid that if you disclose those conditions, then your premium is going to be higher. That's not true. Yeah.
Another misconception there.
It's another misconception, yes.
Okay. How do people get in touch with Jubilee Insurance?
So we are available. I'll give you our contact.
Yes.
We are available on Wabera Street, ground floor, but you can also reach us by text the word health to 40643. Health, and send the word health to 40643. You can also reach us on phone 0709 949 000. 0709 949 000.
Yeah.
You can also talk to us at jubileeinsurance.com. But ultimately, if you call us, we will provide. And this phone is pilot line. Once you call, there are various people that receive the number. They call, and we'll speak to you and provide information.
All right. Anything that we've not touched base on that you would want to say before we close it?
Yeah, we know statistically that Kenyans who have insurance, at least private insurance, are only 3.2% or 3% of Kenyans in the Republic. Yes. So what insurance companies call penetration. Developed countries, because they are developed, they have more money than us, or they have infrastructure and they have things that are working, have upward of 60% penetration, and a whole myriad of other arrangements that help people when they have sicknesses to pay for their bills.